want to start by expressing my support to the families involved. As a father myself, I know what it is like to have a sick child, but I cannot begin to imagine what a parent goes through when they lose a child, no matter the reason. I assure you that you and the families that they have the full support of the health team, and counseling of family members remain an option. When we became aware of the issue at both hospitals, we immediately assigned a team to work with them to conduct investigation and provide guidelines for case management. The team from the ministry visited Cornwall Regional last week. When I was informed on Friday, while in St. Anne, of the situation at the University Hospital of the West Indies, on Friday night I met with the chairman and 7 other members of the board of the University Hospital in Kingston. Coming out of that meeting, I instructed that all the critical stakeholders should meet on Saturday morning at the university. After that meeting at the university, there was a press release which informed of the press conference this morning. Again on Monday the 19th, the technical team met, chaired by the Chief Medical Officer, Dr. Marian Bukat. It is against this background that the technical team will give more specific information on each of these facilities later on. As a precautionary measure, I spoke with the Executive Director of the Caribbean Public Health Agency, Dr. James Hospitalis, and they are on standby to give any assistance that we may require. I also spoke with the Director of the Pan American Health Organization, Dr. Carissa Etienne, who is sending an advice on infection prevention and control. She is scheduled to arrive in the island from Washington today. In addition, I have been informed that there are 3 additional persons coming from PAO within the next 24 to 48 hours. The ministry has put in place several measures to improve delivery of service and quality of care at public health facilities. As part of this, we have placed renewed focus on infection control and sanitation in health care facilities. We already have standard protocols and procedures in place specific to maternity, operating theater, neonatal units, intensive care, and accident and emergency, MONIA, to guide these practices. In order to strengthen infection prevention and control procedures and practices, the ministry has engaged a medical microbiologist at the central level who is charged with visiting and working with other facilities to ensure that these practices are kept to the standard that is accepted.